Skill 8, donning and removing transmission-based isolation garments. Number 1, assemble equipment. You will need a mask, gown, and gloves. Number 2, verbalize. Hands have been washed and jewelry removed.
My hands have been washed and jewelry removed.
Number 3, donning or putting on the gown. 3A, if the sleeves are long, roll them up above the elbows before applying the gown. 3B, lift the gown by placing the hand inside the shoulders. Only touch the parts of the gown that will be against your body and not those parts that will be touching the patient. 3C, work arms into the sleeves of the gown by gently twisting. 3D, place your hands inside the neckband and adjust until in position, and tie the bands at the back of the neck. Please note, correct procedure includes tying the neckband before the waistband. 3E, reach behind you and fold the edges of the gown so that your uniform or clothing is completely covered, and then tie the waistband. Four, donning or putting on the mask. 4A, secure the mask under the chin and cover the mouth and nose. To prevent contamination, it is important to ensure the entire mouth and nose are covered. 4B, either place the elastic bands behind your ear or tie the mask securely behind your head and neck by tying the top ties first and the bottom ties second. Please note, if using a tied mask, correct procedure includes tying the top ties first and the bottom ties second. Five, donning or putting on gloves. 5A, put gloves on and make sure that the gloves are covering the top cuff of the gown. One common error is not having good coverage when applying gloves. To prevent this mistake, Make sure your gown is tucked well inside and underneath the top of your gloves. Six, removing the gloves. A. Remove the first glove by grasping the outside of the cuff with the opposite gloved hand and place the glove over the hand so that it is inside out. B. Remove the second glove by placing the bare hand inside the cuff and pull the glove off so it's inside out. C. Place the gloves in the infectious waste container. D. Wash your hands or use an alcohol-based hand rub for hand hygiene. Proper hand hygiene is essential in preventing the spread of germs and infection. 7. Removing the gown. A. Untie the neckties and loosen the gown at the shoulders, touching only the inside of the gown. B. Slip the fingers of one hand inside the opposite cuff without touching the outside of the gown and pull the sleeve down over the hand. C. Use the gown-covered hand and pull the sleeve down over the opposite hand. D. Ease arms and hands out of the gown, keeping the gown in front of the body and avoiding touching the outside of the gown with your hands. E. With hands inside the gown at the shoulders, bring the shoulders together and turn so the gown is inside out. F. Fold the gown in half and roll it together. G. Place the gown in the infectious waste container. Eight, removing the mask. 8A, untie the bottom ties first, followed by the top ties, or remove from behind the ears. 8B, hold mask by top ties only and drop it into the infectious waste container. 9, wash your hands or use an alcohol-based hand rub for hand hygiene.